We're now joined by Dr. Colette Michelle Barrow, Executive Director of Community and Population Health at University Hospital. Good to see you, Dr. Barrow.
Hi, good evening. Good to see you as well.
It's all good. Listen, I want to find out what this Trauma Recovery Center is at University Hospital. What is it, and what exactly is untreated trauma? Please, doctor.
So here at University Hospital, we have a number of victim service programs, one of them being the Trauma Recovery Center. It is a 16-week program for individuals that are survivors of interpersonal violence. And by interpersonal violence, I'm talking about a range of victimizations, including whether it's rape, gunshot wounds, stabbings, assaults, abuse, the list goes on, bullying, it goes on.
But untreated, listen, I'm curious about this untreated, meaning it's not acknowledged, or it's not acknowledged but not dealt with. Help us understand that.
So I think it's both. I think you can have trauma that is acknowledged, but that is untreated. That's probably the one that all of us, at the point of our life, we've experienced some level of trauma, but all of us have not received therapeutic care. In this particular program in the Trauma Recovery Center, individuals go through 16 weeks of therapeutic case management with licensed social workers who provide therapy. And then we also have a psychiatrist, if necessary, that provides them with medication management, and also a psychologist that works with the social workers to make sure that these individuals are receiving the care that they need. And so you have those first group of folks that know they need help. They've suffered some sort of trauma in their life, and it's impacting their life. It's impacting the way they live, and they want to get help. And then you have other people that are living with trauma every day, who have not yet, whether it's because they don't have access to mental health services, or simply they don't know that they need it yet.
Dr. Barrow, describe your background and experience coming into this role. Describe it.
Certainly. And so I'm a PhD, and so working in a hospital, I always distinguish myself that way. I started my...
Yeah, I have to tell people, excuse me, but our kids will often say, I've said this on the air, Dad, you're a PhD. You're not a real doctor. You're not the kind of doctor who can help anyone. You actually help people.
So, yes, I actually help.
You're a PhD
people.
who helps people. Oh, go ahead.
That helps. Yes, I teach and I help. So that's a great combination.
That's right. So you have that background coming in, but why? Here's what I'm really trying to get at: is what interests you from a professional and personal point of view in the subject and the reality of trauma, people's experience with trauma.
The other day I was driving down the center of Newark, and on this particular block there were a number of boarded up buildings. And right next to it was a school, the elementary school. And I began thinking about the lived experience of young children who are coming out of a building every day and seeing boarded up buildings. I also thought about these children that perhaps are living in communities where there's poverty, but also there's violence, right? There's a threat of violence. There's hearing about violence. Newark has a high rate of crime. Newark also, unfortunately, suffers from a great rate of gun violence. What does an individual living in that community, what do they go through? What do they experience? Those are the persons, many individuals that have experienced trauma themselves, but they've experienced themselves, or they've witnessed it. These individuals need help. I grew up in an inner city community.
Where'd you grow up?
I grew up in East Harlem. And so the era, I won't give away my age, they say it's improper or it's rude to do so. When I grew up in East Harlem, on Park Avenue, there was prostitution. I was surrounded by a number of substance abuse support services. I was right next to in a place where people would go to get methadone treatment. And so the community I lived in had a lot of drug infestation and also crime. And so living in that community, you take on, whether or not we realize it or not, and that's the need for a place like a Trauma Recovery Center. Whether we realize it or not, we are living with trauma every single day. And so most people who live in communities or have experiences like this are not seeking the care, again, because it's either access or they don't know how to get the care that they need. And so I'm driven by my own experiences.
It's clearly personal and professional for you. And one of the things I wanted to follow up on is the hospital-based violence intervention program.
Yes.
What is it?
So the hospital-based violence intervention program, which we call HVIP, also works with individuals who are survivors of violent crimes, whether it's, in many cases, this program dealing with those who are survivors of gunshot wounds, stabbings, assaults, but this is a little different. These are individuals that have dealt with what you refer to as street crime. And so in this program, we have community health workers. These are peers, people who come from similar communities, have lived similar experiences, and they're able to relate to these individuals. Research says that if a person is a first-time injury from something like this, that if they receive intervention, they're less likely to endure another injury. And so most of these situations, these are intentional crimes that were done towards these individuals. So the community health workers are working with them through the process of healing, connecting them to additional resources that they may need. They're helping them fill out their victim compensation application, which is a tedious process, helping them support that they need, referring them to legal services if they need that. And the list of things that they do for them, it goes on and on.
Before I let you go, I have 30 seconds left. Is it fair to say clearly, it sounds like such a self-evident response to this question, COVID has exacerbated issues of trauma and violence, clearly, certainly, particularly in urban communities, right?
Yeah, certainly. It certainly has. I mean, I think especially in urban communities where you're already dealing with high rates of health disparities, you're already dealing with socioeconomic inequities. And so to have a pandemic on top of that exacerbates what people are going through. Newark faced and other communities like Newark face higher rates of deaths due to COVID. And so individuals living there have seen or experienced and have lived with the reality of their family members and friends suffering and some dying, unfortunately, from COVID.
Dr. Colette Michelle Barrow, we appreciate not only you joining us, but more importantly, the work that you and your colleagues do every day at University Hospital, one of our institutions of, I was going to say higher learning, but it is actually a learning institution. And our great friend, Dr. Sharif El-Nahal, who's gone on to do other important work, but University Hospital is one of the healthcare organizations that supports what we do. I want to thank you so much, Dr. Barrow, for joining us. We appreciate it. Wish you all the best.
Thank you so much.
I'm Steve Adubato. That is Dr. Barrow. We thank you for watching us. We'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the Healthcare Foundation of New Jersey, Investors Bank, the Northward Center, the New Jersey Economic Development Authority, New Jersey Institute of Technology, the Fidelco Group, Summit Health, and by NJM Insurance Group. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by Meadowlands Chamber.
Are you looking to be a part of a dynamic, forward-thinking business service organization? At the Meadowlands Chamber, every day we connect, collaborate, and innovate, helping to drive business and economic growth in the greater Meadowlands and New Jersey. I invite you to visit our Meadowlands Chamber headquarters, an open office facility with access to resources for our members' businesses and networking needs. Together we will build the Chamber of the future and the next generation of leaders.